Okay, so this is my rant on healthcare. Again, uh, you will see me smoking. Um, I try not to in my videos, but it happens. Um, Even though this is a rant, I will try not to rant too much. Um, so I know everybody has their opinions on healthcare. Everybody has their opinions on Obamacare and whatever. Um, this is mainly about health insurance. So, um, I've always had health insurance through my work. Um, when I got really sick back in July 2014, I had to quit both jobs and therefore lost my insurance. And of course, this Obamacare, let me take a step back real quick. Universal health care does work. It's been proven in other countries that it does work. I don't care what your opinions are. You can ragefully disagree with me in your comments below. That's fine. But Obamacare is like they all sat around in a circle and said, okay, guys, universal health care works in other countries, so let's do that. But let's find ways to totally just F it up. They did not do it correctly. My biggest issue is if you don't have enough money to afford health insurance, you have to pay a tax. So because you're too poor to afford health insurance, you have to pay. So instead of looking into other ways to help you afford health care, they just say, oh, no, you just got to pay tax. Yeah, because that makes sense. Anyways, so to avoid not only this tax, but also because I had health issues, I had to look into buying health insurance. Well, at the time, the market wasn't open, the healthcare market. And I didn't know too much about it at the time. So I just had to research online and find some insurance. And it was pretty shitty insurance, but it was enough to get me through. Luckily, my grandmother was nice enough to pay for it for me. And then I had friends, and then my boyfriend stepped in and helped me when he and I started dating. So, I had to pay for it out of pocket, and it was pretty expensive, but it was, I believe it was about $190 a month. It wasn't the best insurance, but it wasn't the worst insurance I've ever had. So, I mean, it was decent compared to other insurance that I would soon come across. However, because of this Obamacare, doctors, and I've recently learned that this is a regional thing. This isn't all across America. Because I've spoken with other people in other states, and they have told me that their doctors don't do this, or that they've not come across this. So here in Louisville, in this area, doctors have had to protect themselves. And I'll get to the point in a second. When I was able to get back to work and everything, my job did not offer medical insurance. They offered dental and vision, but because they did not offer what Obamacare considered sufficient insurance, they could not offer medical. So we had to go through the marketplace or whatever. So I just kept my insurance that I had at the time, and whatever. Well, anyways, the security firm that I work with got outbid on the job that I was working with. And I decided to stay with the company that I was contracted to, which means I had to switch the security firm from with whom I was employed. So I had to change my employer. Well, whenever that happened, they actually offered medical, and I signed up for it. And it was the shittiest insurance I've ever had. I was paying I want to say about $250 a month, and my I hate it when this happens. Deductible. Ha, got it. My deductible was $2,000. $2,000. And this was the silver plan. Yeah, $2,000 deductible. I've never, ever, and I've had my own health insurance since I was 17. After I've had Medicaid once, it was pregnancy Medicaid. After that, I've had my own health insurance, and I've never ever had that high of a deductible. It was $2,000. Not only that, but I had another $2,000 deductible on pharmaceuticals, so pharmacy. I've never heard of a separate pharmacy or pharmaceutical deductible separate from medical on the same insurance. It was ridiculous. I've never heard of that, ever. Well, the issue with this insurance was, okay, so keep in mind, I'm paying $250 a month for this, okay? So, I then learned that there is a difference. There is a such thing as a copay insurance and a co-insurance type of insurance. Never before had I ever run into this problem. I've always had insurance. Sorry, my nose is kind of like running. I've always had insurance where, you go to the doctor, you pay a copay, and you go on about your business, and then eventually the insurance is billed, and then you get a bill. Yeah, this insurance was totally different. Because on the card, it did not say I had a copay. It was considered a co-insurance type of insurance, which meant that the insurance was billed first. And I didn't have a copay. Sounds good, doesn't it? No. Because the doctors around here, to protect themselves, whenever a patient had that type of insurance, your first visit with them, you had to pay $100 up front. Your first visit. And then every visit after that, it was $50. So pretty much your copay was $100 your first visit, and then $50 after that. But I might as well just not have insurance. That's pretty much what I'd be paying. That's pretty much what they'd ask you to pay if you didn't have insurance. So why am I paying $250 a month to pay what I would pay if I didn't have insurance? So I'm paying $250 a month just to not get taxed for not having insurance. Well, it didn't just stop there. Then I went to go fill my prescriptions, which I had already been on. And some of my prescriptions I really need. Some of them, if I go without, I'm okay. Some of them, one of them I'm on, and if I quit taking it, I'll go through withdrawal. My body's used to taking it, and I'll go through withdrawal symptoms. It's a medication that I need. The other medication was a muscle relaxer, and yeah, I really need it, but it's not. I'm gonna have muscle spasms and everything, but I can deal with it. The other one, which I'm talking about, is Klonopin. I'm taking that for 3 reasons. I'm taking that, originally I was taking it for the sleep paralysis. But it also helps with my anxiety and my restless legs. So I've got one pill that kind of kills 3 birds with 1 stone. I started taking it regularly. I was taking it just PRN, as needed, for the sleep paralysis. However, lately my anxiety's gotten a lot worse, especially with this illness, and my restless legs has gotten really, really, really worse, with the muscle spasms and everything. So, I've been taking this regularly. You cannot stop taking a benzo, just stop taking it. You'll have physical withdrawal symptoms and mental withdrawal symptoms. Irritability, even depression, you can continue on with daily life, but you just, want to tell everybody to piss off. And, so anyways, my point is I went to go refill my medications, and, those were just 2 of my medications that I was on. And if you watched my introduction, you saw my MAR. You've seen how many medications I'm on now. At the time, I was on a lot more, actually. So I went to refill my medications, and insurance wasn't paying anything for it. And I'm like, I don't understand. Did you bill through my insurance? And they're like, yeah, you have a $2,000 deductible. And I'm like, yeah, but that's for I'm confused. And they explained to me that I had to reach my $2,000 deductible when I called them. I had to reach my $2,000 deductible for my pharmaceuticals before they would pay a penny on any of my prescriptions. Yeah. So I had to pay out of pocket for all of my medications. And at the time, I did not, we were, I had just started back, I think at the time, that was when we just switched. So, that was when we were actually working a bunch of overtime. So I needed my medication. I was in a lot of pain. I didn't have time to do a lot of stuff, and my overtime was going straight to bills. We were playing catch up, and we were paying bills and stuff, and I'm like, yeah, I'm paying all this overtime, but I'm also paying $250 a month for insurance. For what? I mean, I don't have the money. I don't. I'm paying medical bills off from the past so they don't go to collections, because I eventually want to get out of the apartment and get a house and yada yada yada. And I'm already paying an outrageous amount of money for this health insurance that is literally paying nothing. I'm literally paying $250 to a company for them to do nothing for me. They were literally paying nothing, and it was ridiculous. So I was told about the marketplace and was able to get on to a new plan. Now, this new plan, I didn't know anything about the marketplace, didn't know anything about the tax incentives or whatever. They took my income from the year before, which I was sick a lot, so I had a pretty big incentive. So I was able to get a plan that was almost $300 a month, and I only had to pay $121 a month. Which when I filed my taxes this year, they were oh so nice to tell me that I had to pay some of that back. I'm like, okay, well, you all calculated that, so why do I? I don't even know where to begin with that. I really don't. So, anyways, I'm on this plan. I switched that plan. Of course, now in order to, when you have health coverage, just to let you know, if you ever want to switch health coverage, you can't call your insurance company and just say, okay, I don't want this anymore. You have to have proof of another health coverage. So, yeah. I had to call my HR and tell her that I was going to switch. And she had to tell me the process of all that. So not only are they still taking it out of my check and everything, I had to pay for the new health care insurance, program out of pocket before I could cancel my new one. And of course, they told me that they would reimburse me, and they never did. And every time I called, they kept rerouting me to people who can't hardly speak English. And I'm sorry, but if I can barely understand you, you can barely understand me. If I have to push one for English, I should be able to speak to somebody who speaks frickin' English, okay? And they keep rerouting me to people, and to this day, I've not been reimbursed the prorated amount that I was supposed to get back, which ended up being almost, I think, $195. So, yeah, that company still owes me $195, which would come in handy right now. So, actually, I'm going to retract that statement. It actually wasn't when we switched to the new company. It was right before we switched to the new company. Our first company was able to get the shittiest bottom line insurance that Obamacare would approve. Like, it barely met the standards. And that's when we all signed up or did the marketplace thing. So I wanted to make that correction because it just came to me because I remember talking to the HR lady with the original company that I was with about that. So anyways, when the new company came, I was like, no, I'm just going to keep this insurance I have now. So this insurance I have now was paying $121 a month, and I loved it. I pay $10 a month for copay for doctor's visits and $30 for specialists. What's awesome is they didn't put it on my card. So most places don't question it, and sometimes they don't make me pay a copay. So I'm like, I don't say anything, and I'm just kind of like, okay. Some of them want to argue with me and say, well, since it's not on your card, then you have a co-insurance kind of. I'm like, no, I've been through this BS before. You can call my company. It is not a co-insurance plan. I made sure of that when I bought the plan. And I've only had to go through that one time. It was with the urologist when I had that bad urinary tract infection. Luckily, that got straightened out. Well, now they sent me a new card that does have that on there. So now I can't get away with, kind of ducking out on the copay, which is fine because it's one of the lowest copays I've ever had with an insurance. However, this year, because I made more money last year, they jacked it up to $161 a month. I didn't get as much of a tax incentive, which, I mean, is still pretty cheap as far as health insurance goes. I remember, when I worked for VOA, I was getting probably, I think, about 89 to 90 something a check deducted out, so about $160 to $180 a month. So, because we got paid twice a month, so it's about the same, and it's pretty decent insurance. However, the people that work there suck. They don't know what the hell they're talking about. And this is the issue that I have with health insurance is their policies are changing because they're made to change. They laws keep getting passed to where they have to change certain policies, and they change them so rapidly that we don't get notified as quickly. And a few examples are, well, hold on, going back to my premium, one thing that I'm pissed off about is I went back on the marketplace because I needed help paying my premium, because even though, yeah, it shows that I made more last year, I've not made money since November 2015. My last work date was, I believe, November 15th. And then I had my anniversary pay that was supposed to come to me in October 2015. They ended up getting backlogged and didn't pay until December, but it was $300 and something. So, I mean, what to do? It just helped me buy a few things for Christmas. And I paid my credit card bill. That was about it. Other than that, I've had no income. So I go on there and I put in my information. And of course, they send me this thing for Medicaid. I don't want Medicaid. My doctors don't accept Medicaid. I would have to switch doctors. And some people are like, well, yeah, but isn't that a small price to pay? I'm like, you don't understand. I've been to so many doctors. Once you finally find a doctor you trust, you don't want to switch doctors. I finally have a doctor that I trust that listens to me. I'm trying to blow the smoke out of the way of the camera. Sorry. I finally have a doctor that I trust and a doctor that knows what's going on with me. I don't want to have to go through all that again and explain to my doctor, to a new person, everything, and I don't want the insurance company to dictate who I can and cannot see, even more so than they already do, because of course now you have to get referrals for everything. You have to, they send you letters for every test, almost every test that I've had to do. I have to have it signed and everything. Even medications have to be pre-authorized. Well, if the doctor wrote the prescription for it, then the doctor authorized me to have the medication. Why do you need to ask the doctor again if they authorize that medication? I've been having a lot of those. Like, I go to fill my prescription, and then it says, oh, well, there's a delay because we need a pre-auth. Really? Doctor kind of authorized that when they wrote the prescription. I'm just saying. So, instead of getting my medication when I need it now, I have to wait for frickin' ever, because, the doctor get it, and, the doctor's busy, so it could take them until the next business day to get it back to the pharmacy. Well, of course, the pharmacy sends it to the insurance or whatever they do, and the insurance company, my insurance company at least, takes forever to do everything. I was on a point a minute ago, and I kind of lost it. And I was going to go back to it, but I kind of forgot what it was. I hate it when I do that. That's why I hate ranting, because I forget where I was on certain things. Let's see if I'm pausing. Go back to it. Anyways, so, I don't know if this is the point I was on or whatever, but they wanted to put me on Medicaid, and I said no. I don't want Medicaid. It will not do me any good to be on Medicaid. The extensive care that I need will not be covered. The doctors that I see do not take Medicaid. The doctors that I need to see do not take Medicaid. So Medicaid will not help me. So instead of, this is what I don't understand. They wanted to put me on Medicaid and only charge me $10 a month for it, instead of just helping me, maybe knocking, say, $50 off my premium or whatever. I even noted on there, because there was a description thing where you could write, and I told them that I'm living off of my boyfriend's income, and he's paying my premium. And I said any little bit helps if I could get help paying my premium. Or get my premium lowered, or get more of a tax incentive, or however it works. So then they set me up an appointment with the Family Division Resource, or whatever it is, the FDR, for a Medicaid appointment. I'm like, I don't want Medicaid. So you're willing to give me health care for $10 a month instead of just giving me a little more tax incentive to help me pay for my premium? That doesn't make sense. So you'd rather give me pretty much free health care instead of just giving me a little more leeway on my premium. That's another thing messed up with this health care. So another thing is, with my health care, is my health insurance is going back to the laws and everything about them changing shit. With my health insurance, I don't know if everybody does this or what. I have what is called a grace period to pay my insurance. It's up to, I think, like 4 to 6 months or something. I've never heard of this. And whenever it first happened, I got behind. And when I called to ask them. I was actually just asking them if I could have 2 weeks to pay it on the next check. And they were like, actually, you have until, like, it was like 4 or 6 months later. And they were like, you have this grace period. I said, oh, okay, well, I mean, I'm going to pay it before then, but I just wanted to make sure that my benefits and such are not going to be interrupted if I pay it late. And he said, oh, no, absolutely not, as long as you pay it within your grace period. And I had him explain this thoroughly, just to make sure there was no miscommunication on this. And this was back in, I want to say, July. And I actually had the date written down. I always, anytime I call people, especially places like this, I always call, and when I write down the name and the date and everything. So anyways, this time I missed February's payment, and I haven't paid March's yet. When Andrew got paid this Thursday, we were going to pay February's, and then when he got paid next time, we were going to pay March's, because I have a grace period until June. Well, all of February, now keep in mind, I have not paid February. All of February, I've been going to the doctor, I've been filling prescriptions, everything. No problem. Soon as I go to fill my pain medication, it gets rejected. Yeah. Like, the one medication that I really freaking need, it gets rejected. And the pharmacy, they get a message saying premium not met, call insurance. So I had to call my insurance company, and she tells me that, well, your premium's not been paid for February, and now we're entering March. And I said, well, I have a grace period until June. I looked it up, and it's till June. So do whatever you got to do, put my shit back in order. Like, I should be able, well, and then she explains, well, the grace period just saves us from dropping you. But you cannot use your benefits. And I'm like, okay, well, that's not how it was explained to me last time, and last time I was able to use my benefits. So I don't know what you got to do on your computer to make that happen, but you need to make it happen. Well, she says, I don't know, you were explained wrong. And I'm like, well, I wasn't explained wrong because I was able to use my benefits. So it wasn't the explanation that was wrong. So she tells me, well, if you make a payment today, then within 24 to 48 hours, your benefits will be restored, whatever. So Andrew said, okay, just go ahead and put it on the credit card, whatever. So she says, well, and she says, I cannot take payments over the phone. We're not allowed to do that anymore. So she transfers me to the automated system. The automated system says that my balance is $80. Now, I'm not a mathematician, but 161 and some change plus 161 and some change is not $80. So I'm thinking, okay, maybe they got it approved to lower my premium. I don't know how they got it approved for $40 a month, but that's what the system says I owe, so we paid the $80. So I start thinking about it again, and I'm like, that doesn't sound right. So I call them back, and I talked to another person, and he says that because I looked online, and it said my premium was still $161 for February and March. So I'm like, okay, yeah, I'm going to call them because this doesn't make any sense. And he says that she was correct about the whole grace period. And I said, okay, when did this change? Because I did not receive any literature in the mail. I did not receive an email or anything. And he said, well, it's the way it's always been. I said, okay, well, you're incorrect, because you can go back, if you want to go back through your recordings in July, you can look up when I called. There's a recording where somebody had explained it to me that I would not lose my benefits if I used my grace period. And you can look at my claims and see that I have claims for July for the doctors and for prescriptions. And I did not pay my premium in July on time. I paid it almost 3 weeks late. So somebody there has got shit messed up. And they also like to not apply payments. They have two different departments. They have departments that take payments, and they have department that applies payments. And what's really funny is when I go online, I can see that my payment has been received, and then my payment has been applied. And there's actually 1 month for last year that says that my payment was received. All of the months say payment has been applied, but there's 1 month for last year that does not say the payment has been applied. It just says payment received. This company is so messed up. By the way, it's United Healthcare. So, anyways, so he tells me that I need to pay, I think it was $243, because I'd already paid the $80. So I need to pay $243. And then within 24 to 48 hours, my benefits will be restored. So I explained to him, this is ridiculous, that if I had been aware of that, I would have went ahead and paid my premium when I had the money. That this was one of those bills where I'm like, okay, I can hold off on that because I have a grace period. If I had been notified that the grace period rules had changed, I would have went ahead and paid it. Not only will this mess with me going to the Mayo Clinic, but I cannot survive a 13-hour drive to Minnesota without my pain medication. I can barely. Today, for instance, every time I woke up, when I was laying in bed, I had to take a Phenergan to knock myself out because the pain was unbearable. Lately, the past month, I've been sleeping in the recliner. For some reason, laying flat in the bed hurts. And, because I'm going to be gone for a week, I wanted to cuddle with my boyfriend. And I thought maybe it would give my hip and leg a rest if I tried to lay in bed. And it hurt my back really bad. And when I woke up, I didn't even want to try to go to the recliner. I just took Phenergan to knock myself out. Because I have no pain medication. I called Walgreens today. It's been 24 hours since I made my payment. I made my payment in full. My mom was nice enough to give me the money after she sold her truck. And my grandmother was nice enough to let me borrow money for the trip to the Mayo Clinic. So we're good on that, sort of. So I was able to pay my insurance. So it's been 24 hours, over 24 hours. And I called Walgreens and asked them to run my insurance, and it's still not gone through. So I'm pretty much in limbo, at the mercy of my health insurance company. I am in a tremendous amount of pain. there's no words to describe it. As you can see, I'm in my recliner right now. My boyfriend had to help me to my recliner. I had to wait 3 hours after he left for work. Actually about 4 hours for my mom to get here, for her to help me to the bathroom, because I was just in too much pain to make myself move. That's not right. There should be a quicker way. I don't think patients should be at the mercy of health insurance companies. Because I had the money, I could go pay $77 for my prescription. But then that $77 that I could use for my Mayo Clinic trip. So, or pay my insurance, and I need my insurance to go to the Mayo Clinic. So, it was a hard decision, and it's just a shitty situation. And of course, because our lovely DEA, and because people who don't need pain medication, who take it anyways, screwed everything up for us who are really in a lot of pain and really need it. All of my medications, and some of them are scheduled drugs, they're just lower level. All of my medications can be transferred to other Walgreens. So whenever I go to my to Minnesota, if I need to refill, say, my Klonopin, which is Schedule 4. It's a scheduled drug. Let's just put it that way. Even though it's a scheduled drug, they can transfer it to another Walgreens. However, when I called, because I knew the answer was no, but I figured I would ask, because I'm like, well, maybe on the way we can stop, maybe by the time we hit Illinois, my insurance will go through and they'll be able to do it when we find a Walgreens, and then wait on them to fill it there. Because hydrocodone is a higher scheduled drug, and because of laws passed, because people like to abuse drugs, they cannot transfer that, even though I have physically given them the paper prescription, and they have it at my Walgreens. They cannot transfer that medication to another Walgreens. I would need to take that paper prescription with me and have them fill it at another Walgreens. The problem with that is, in pain management, I have to fill it at a pharmacy in Indiana. So I'm screwed there. So I can't leave tomorrow, well, technically today. I can't leave until my insurance goes through so that I can get my pain medication. Because, like I said, I'm not going to survive a 13-hour drive without pain medication. It's not going to happen. Not to mention, I'm going to be gone over a week. I'm going to need pain medication. So, it's not going to happen. So I have to wait until my insurance goes through. And I've already booked the hotel, and it is non-refundable. So I may end up having to call my insurance company tomorrow and get in a big argument with them and tell them, look, you're going to cost me even more money, and whatever I have to say to get them to push whatever button they have to do to make it go through faster. It's just healthcare, and with the elections coming up, everybody's wondering about healthcare and what our next president's going to do with healthcare and everything. And the insurance companies should not be allowed to do what they are doing to us. I've seen videos, people talking about, you know, not being able to get their medications and such. Well, it's just like whenever I tried to get my Chantix to quit smoking, they wanted me to try the patch first. I've tried the patch first. I've tried Chantix before as well. I had a better success with the Chantix, mainly because the patch hurts my arm. I don't know why, it hurts. It feels like an ache to the bone wherever the patch is. And I prefer Chantix. But not only did they want me to try the patch first, it had to be through a prescription. Well, it turned out to be cheaper to buy over the counter than by prescription because the insurance company didn't pay for it. Like they paid like $5 off of it, and the prescription for it was some kind of brand that was quite expensive, and it ended up being cheaper to buy like the Walgreens brand of it because they were even having a sale on it. And I bought 2 boxes, the step 2 and the step 1 for $30. And just 1 box of the step 3 from my prescription was going to be almost $50 some. And I had to buy that from them and use that, and then use step 2, which was going to be another $50, and then step 1, which was going to be another $50, before they'd even consider paying for the Chantix, which Lord knows how much that was going to cost. So I'm like, that should be considered preventative medication. You know, because you getting me to quit smoking, you'd think they would consider that to make me healthier. So, you know, that kind of goes into the conspiracy a lot of people have that, you know, that they want us to stay sick because they make money off of it. You know, I'm not going to go too much into that because it's, you know, I believe some conspiracy theories. Some of them are a little far-fetched, some of them are not. I don't know what you believe, but whenever they tell me that, you know, most of my prescriptions are $5, almost all of them are, some of them are even cheaper, but then they won't pay for a medication that will make me healthier, makes you think. You know, this is an actual medication that will legitimately make me healthier as a person, because I won't be smoking, which is what I'm doing. You know, chain smoking almost. I'm up to 2 packs a day because of the pain and the medication I'm on. Well, today because of the pain. And they won't pay for medication to help quit smoking. So, we're pretty much forced to pay for healthcare insurance that provides us with minimal service, that constantly gives us bullshit every corner we turn, or we have to pay a tax, And today, if you don't have insurance, good Lord, you can't go to a doctor. I mean, they make it so expensive, and you have to pay it up front. You have to have insurance. Not just to avoid the tax, but these doctors, I mean, unless you happen to find a free clinic, which I don't even know of any around here anymore. Excuse me. I think there's one here still going, and it takes months, like months to get in. And I don't mean like 2 or 3, I mean like 6 or 7. Well, if you've got bronchitis, you might as well just go ahead and go to the hospital, because you're going to have pneumonia by the time you get into the free clinic. So you're forced to buy health insurance that gives you hell, and you're at their mercy. They dictate your health care and how they take charge of your health care. An example of that is I have families, and this goes to the whole Obama thing, which really pisses me off. He said that when this happened, people who are on Medicaid and Medicare, you will be able, and you can Google this, he said you will be able to keep your doctors, you will be able to keep your pharmacies. He said this, okay? I have family members who can no longer use their doctors or pharmacies that they normally use. And this is a very big inconvenience, and I'll tell you why. Because they were using Walgreens, and the Walgreens they use is over 24 hours. The medication's cheaper, and they just overall were a better pharmacy than the pharmacy they have to use now, which is only open certain times of the day, certain days of the week. It's not the greatest pharmacy. They jack up prices because they know they can, because they know they have to use that pharmacy. And that's bullshit. So that pharmacy is getting kickbacks because they are on Medicaid. And so, you know, it's a very corrupted healthcare system that we have right now. And it's not just patients getting screwed. Doctors, nurses, the whole healthcare industry, they're getting screwed too, and that's why they're having to implement these rules and fees to protect their assets and their stuff as well, so that they don't get screwed by the health insurance companies, so that they make sure they get their money. I mean, if you went to school for 10 plus years and you're paying off student loans, that are, growing out of your ass, you'd want to make sure that you're going to make your money. So in order to do that, you've got to implement fees and such, with a corrupt healthcare insurance industry right now. The only good point, and I hate to say this, one good point that Trump did make with his, with what he said was, he kept repeating the lines around the states, and Rubio kept asking him to elaborate what he meant by that, and I don't think a lot of people know what he means by that. And that's because the dumbass kept repeating himself instead of elaborating. What Trump meant by that is the insurance is sold state by state. That's why whenever you call your insurance company, they ask you what state you're in. Each state has their own rules. It's just like whenever I called my insurance company to make sure that the Mayo Clinic was covered. In Indiana, my insurance is not covered. I don't have out-of-state coverage unless the doctor is in network. The first time I called, I was very devastated because the dumb bitch did not tell me that last little part about it. Luckily, I thought about it and was like, wait a minute, I see doctors in Kentucky, and put myself together enough to call back and talk to this awesome gentleman who explained to me, as long as they are in network, you have out-of-state coverage. Anyways, going back to the whole Trump thing, he was correct. If we have insurance companies competing without the state borders, then there is a better market for us to choose from. Better policies, better, more insurance policies and coverages, and companies to choose from. That's about the only thing that he has spewed out of his mouth that I agree with. Again, if he would have elaborated on that instead of just repeating himself 20 times, then maybe it would have been understood. But that's the thing. If I were in Kentucky, I wouldn't have had the same choices that I did as I did in Indiana. And I don't understand why that was implicated, and I don't understand why that was done. I don't understand why that was enforced. I don't understand the reasoning behind that. There's a lot about the healthcare industry that has changed that I don't understand. And quite frankly, I don't want to, because it would probably piss me off even more. And a lot of things need to change. I have probably at least $20,000 worth of medical bills in debt in collections. And I have new bills coming in daily that I try to pay off, to keep them from going into collections. Well, that's very hard to do when you have no income. So, they just keep coming in, and I can't pay that. So, there needs to be a better way. Besides going on Medicaid and having the government pay for everything for me. I'm not totally disabled. I have something that I believe is fixable. So I'm temporarily disabled. I don't think I should have to take other people's tax money to pay for my medical issues. However, there should be some sort of help for me, to help with my healthcare needs, and there's not. Whenever I did apply for Medicaid a while back ago, I was denied. And the reason why I was denied wasn't because I didn't qualify. I qualified. The woman told me they had ran out of funding. Ran out of funding. But now they're wanting to put me on Medicaid for $10 a month. And I got a bill. I'm not on Medicaid. I didn't go to the appointment. I called them to cancel the appointment and explained to the lady very nicely that I didn't want Medicaid because my doctors do not accept Medicaid. And so she canceled it for me. And everything. And but yet I received a bill from them. Yet I have no card, no nothing. I've received no benefits from them, yet I have a bill from them for $10. Yeah. So, they won't be getting that from me. So, but, yeah, so we need to do something about the health insurance. Something's got to give. Like I said, I do like my policy somewhat. I mean, it's a very good policy, but if I had to pay for it out of pocket without this tax incentive thing from the Obamacare, I'd be paying almost $400 a month. So that, I mean, that's why it's a good policy, because I got that tax incentive from the Obamacare. Thank you, Obamacare. Um, Another good point was my birth control was free. So I mean, there's good things and there's bad. When I switched to the next one on that I was talking about in the introduction, I only had to pay $5 for it. So yay, you know. Some religious people may disagree with that. I think it's a good thing. I think that's one thing we should keep. The world is overpopulated enough, and people want to say they disagree with abortions. Okay, well then put people on birth control. Just saying. That will help with unwanted pregnancies. I mean, I'm not saying birth control is 100% effective, but I'm just saying, I'm pro-life, but I'm also pro not sticking my nose in other people's business. If somebody wants to do that, that's their own damn business. It's their life. It's their guilt they have to live with. However, I don't think it should be government funded. There are some things that should be government funded. There are some things that shouldn't. Another thing with the healthcare system is and I know I'm not working right now, but I have worked my ass off since I was able to obtain a job. So, I'm just going to say this as if I was working right now. If my tax dollars are going towards your health insurance and paying for your health care, you should be drug tested. I have to pass a drug test to get my job to work, to pay taxes. And Medicare and federal taxes and state taxes have gone through the roof recently, which is another thing I'm hoping our next president and Congress can agree on to lower, because taxes are freaking outrageous and ridiculous, and I'd really like to know what they're using them for. But I'm ranting. When I rant, I go into 6 different rants. You should be able to pass a drug test. I'm just saying. I understand the whole marijuana thing. I am pro legalization, but if it's illegal in your state, it's illegal in your state. I'm sorry, but that's just right to your people, and try to get it legalized. I know a lot of states lately have legalized it here recently, or decriminalized it. But anyways, back to the health insurance. You should be able to pass a drug test. If I have to stay clean to work and pay taxes, then you should have to stay clean to use taxes. That's my kind of opinion on that. Anything, and not just Medicaid, food stamps, anything, welfare. If you're using tax money You should be able to stay clean, as anybody would that has to pay taxes for you to use those taxes. And if not, then instead of saying, okay, then you don't qualify, then they should try to help you and get you through rehab. I personally know people who have drug addiction problems, and you can't just, I mean, it's not fair to just say, okay, you're a user, you're shit of the earth, you're whatever. Try to get them help. If they don't want help, then okay, screw them. But, at least offer it. And then look at what they're needing, and if they can continue to pass drug tests, let them use taxes. I think a lot of tax money is wasted, and that goes back to the healthcare. A lot of tax money is wasted on people who, quite honestly, don't deserve it. Whereas there are people who need help with healthcare and paying for their healthcare, And I even told the lady on the phone, I was like, I just need temporary help. This isn't something I'm asking, forever. I just need temporary help, and I can't even get that, even though I literally make $0 a month. I have no income. I have no short-term disability coming to me. I have nothing. And I could not get any help unless I go all the way to Medicaid, which my doctors don't take. So it wouldn't do me any good. So, yeah. So I have talked your head off for over an hour. And there's probably a lot of key things that I've left out just because when I go on a rant, I just verbal diarrhea. So if you want, comment below if you have anything to add or questions about anything. And I will respond or whatever. But I'm going to go ahead and end it here, because now it's going to take forever to upload this video.